From KUNC and the NPR network, this is In the NOCO. I'm Erin O'Toole. An increasing number of expectant parents look to doulas for help during pregnancy. Doulas can offer support and advice that complements a doctor's guidance. Until recently, doula services were not covered for Medicaid recipients in Colorado who rely on the state to help with the cost of their care. A new law that took effect earlier this month changed all that. Now, doula services are covered for Medicaid recipients. Our guest today says this new law could make a huge difference because lower-income patients on Medicaid often have the most to gain by working with a doula during pregnancy, birth, and after a child is born. Joy Tuesigi is a trained women's health nurse practitioner and vice president of health systems integration at Colorado Access. That is a nonprofit that works for better healthcare for marginalized populations. And she joins us now. Welcome, Joy.
Thank you so much for having me, Erin.
Joy, let's start by briefly laying out what doulas do. Could you give us an idea of some of the services a doula offers that patients might not get through more traditional maternal care with a doctor?
Absolutely. So doulas are there for your whole pregnancy. So they're prenatally to provide education, support, answer questions. Some doulas provide personalized classes for families, and then they're there for your labor, as short and as long as it is, and then also postpartum. And they can help with breastfeeding or how to use a pump or how to figure out which formula works the best. So they're there for education, emotional support, and anything else that a family might need.
New parents face a lot of new challenges. Is it easier for a doula to address some of those challenges compared to a doctor or nurse?
Well, the doula has more time to spend with people so that they can understand their fears and their concerns. And typically that time and that building of trust allows for that kind of exchange to happen.
Now, you trained and worked as a doula earlier in your career. Why do you think doula services can make a difference for someone who is going through pregnancy and birth and then also postpartum?
Pregnancy and childbirth are core memories for people. They stay with people for a lifetime. So having someone there before, during, and after can drastically change somebody's life course. It's not right then and there. This isn't a time-bound experience. This is something that goes with you forever, that impacts your future pregnancies, that impacts your relationship with your newborn, with your child, which is why we see increases in breastfeeding with folks who have doula support. The biggest thing is that having this kind of support not only impacts the life of the person giving birth, but also the baby and the family unit as well.
Someone in your position certainly could advocate for a lot of changes to how maternal care is delivered in this country. Why is making doula services more available a priority for you?
Because the disparity is so great, and we have measured the disparity in maternal mortality and maternal morbidity and low birth weight. Like, we know these things to be true and these facts, and this is an opportunity to impact this data, right? And these data are attached to people and real life human beings.
By disparity, are you talking about patients on Medicaid versus those with private insurance?
Yes. So we're talking about patients on Medicaid versus private insurance, but then we're also just talking about disparities across racial ethnic lines. We know the biggest disparities are along economic lines, and we see that in the data with folks who are covered by Medicaid. But these disparities are bigger than that.
This is perhaps a good time to clarify. Medicaid serves lower income populations. What are the kind of challenges people on Medicaid face during pregnancy that might be helped by a doula?
What is so important about Medicaid paying for these services is that, again, it goes back to data. We know that doulas impact for the better health outcomes. And so why keep this away from people who are the most marginalized? That this needs to be a covered benefit, because if people don't have money for food, they certainly don't have money for doulas out of pocket.
And it's my understanding that sometimes people in marginalized communities are more in need of an advocate for them, someone advocating on their behalf within the medical system. Is that something doulas do as well?
They do. And, we recently held our own focus groups and heard directly from folks who are on Medicaid who reached out to get a doula that they did want that support. They did want someone side by side advocating for them who might know more of the medical lingo, who might help prompt them to ask questions that they have, but they're nervous and they forget to ask. And I think that the women and the birthers know this themselves, that having an advocate in the ED is just as important as having an advocate when you're giving birth.
I want to come back to this bill. It was passed in 2023 and took effect, as we mentioned earlier this month. I noticed all of the sponsors of the Senate version of the bill before this became law were Black women legislators. Why do you think that is?
My son turned 10 yesterday, and that brought a lot of excitement and a lot of good memories. But I was really scared as a Black woman when I had this planned pregnancy. I know that I am, this healthcare provider, but I also know that none of that matters when it comes to the data in terms of giving birth, that I'm still equally as likely to end up dead or to have something happen to me that changes the course of my life, or something that would happen to my baby. And so yes, it makes sense to me that other Black women have these fears and they want to make a difference and make a better experience for other people. It is really chilling and frightening to know that it doesn't matter about your education and how much money you have with healthcare disparities when it can it impacts everybody.
Joy Twesigye, thank you so much for talking with us about this today.
Thank you so much for having me.
Joy Twesigye is Vice President of Health Systems Integration at Colorado Access. The Denver Post recently noted that while state officials don't have an estimate for how many expectant parents on Medicaid will request doula care, about 22,000 births in Colorado were covered by Medicaid last year. Before we go today, if you've listened this far, we want to share a couple ways you can interact with the show. First, there's the In the NOCO newsletter, headlines and updates from the KUNC newsroom delivered to your inbox every week. Head to kunc.org to subscribe. And if you want to tell the In the NOCO team what's happening in your corner of Colorado, you can drop us a line, send an email or a voice memo to noco@kunc.org. That's NOCO@kunc.org. And that's it for us today on In the NOCO. I'm Erin O'Toole. Thank you so much for listening.